Ladies and gentlemen, thank you so much to everyone who has attended this event today. I want to thank you for being here. I want to thank you for taking the time to participate in what I see as a significant step forward in our state. Today, I am announcing the introduction of MiCare. MiCare is a single-payer, universal health care plan for the state of Michigan. For too long, we've suffered through a system where families have to decide whether or not they are going to afford basic medical care or go bankrupt. It's unacceptable that we live in a society where the out-of-pocket costs and the co-pays and the premiums are bankrupting our families. It's unacceptable that we continue to increase the cost of health care on our employers. There is a better way. There is a better way, and that is what we are here today to talk about. A better way forward for Michigan. A better way forward for all of our residents. What we are proposing is simple. We want every Michigan resident to have full coverage for physical, mental, dental health. Full coverage for everyone. No more co-pays, no more premiums, no more deductibles. It is a system that will still allow our providers, our doctors, our hospitals to remain independent and for people to be able to choose the medical providers that they need. It is a system where our medical providers will be fairly compensated for the services that they are providing. What we're proposing is that we would peg our reimbursement rates to Medicare, which is a really good reimbursement rate already, and we would add a 10% bump on top of that for our hospitals and our doctors to make sure that all of our providers in the state of Michigan, our nurses, our doctors, our hospitals are all able to continue to provide excellent services and get compensated for the services that they're providing. This system will move Michigan forward economically. It means that our employers in the state of Michigan, who right now have to pay, on average, $5,500 per employee and almost $13,000 per family, it means a cost reduction for them. A cost reduction that we've seen in other countries that have done universal health care has meant an economic growth driver for those economies. It has meant that companies can afford to hire more employees because they no longer have to worry about the exorbitant costs of medical insurance. We're making sure that everybody's covered so that our employers can hire more people, so that jobs can grow in Michigan. And finally, we're doing this here today because we believe that healthcare is a human right. Healthcare is a human right. With over 500,000 Michigan residents who lack insurance today, we believe that's unacceptable. We believe it's unacceptable that a family has to get a medical bill in the mail that may mean that they can no longer pay their rent or pay their mortgage. It may mean they're going to get evicted. It may mean that they can't pay their water bill. It may mean that they can't pay their electric bill, and we all know what a Michigan winter is like. It is unacceptable to live in a society where we are putting our families in Michigan, everyday working Michiganders, where we are putting them in the position where they have to choose. And that's why we're introducing MiCare. So people often ask me, in these difficult times in our country, how do you continue? How do you get up every day and go to work? And my answer is this. I know that change is slow. I know that sometimes it is painful. Sometimes there are days when we wake up and we are discouraged. But I know in my heart that a better day will come for our state, and a better day will come for our nation. And I know that if we set our eyes on progress, we will prevail. We will prevail. We must imagine the future that we want. So today we are imagining a future where doctors don't have to spend hours and hours and hours chasing after medical companies just to get compensated for the care they're providing. We're imagining a future in which the people of the state of Michigan save what we're estimating to be $20 billion in healthcare costs. $20 billion in healthcare costs saved for the people of the state of Michigan. We are imagining a system without copays, without deductibles, without premiums. We're imagining a system. We're imagining a system where we all pay our fair share. We all pay our fair share to make sure that every Michigan resident is able to get the health care they need. We are imagining a future where there does not have to be a choice between going bankrupt and getting cancer treatment. That should not have to be a choice. Where you have to choose between going to the doctor to see if you have a cold or if it's pneumonia or paying your energy bill. That should not have to be a choice. We are imagining a new future for this state. A future in which our economy is prosperous again, where companies don't have to worry about the rising cost of healthcare because everyone is covered. Everyone is covered. That is the future that we can believe that is possible right here in the state of Michigan. It is possible if we all roll up our sleeves to make it happen. MiCare, that we are introducing today, is the beginning of this conversation. It is not the end of the conversation. This bill will be introduced, and let's be realistic, it may not pass this session. But it will be reintroduced the next session. It will be reintroduced the next session, and maybe we can continue the momentum forward. Forward momentum. Progress is where we need to go. Because as we imagine, as we believe in a better future, it is now time for us to roll up our sleeves and fight for it. Thank you all for being here.